future of medicine. Imagine a treatment that tells your body to stop attacking its own joints without wiping out your immune system. A groundbreaking new study proves it's possible. But here is the real breakthrough we need to reveal right now. Scientists didn't invent a new artificial blocker. Instead, they discovered a hidden off switch already written into your biological source code, driven by a specific type of fat molecule. The question is, how do we flip that switch? Think of your immune system like a highly advanced operating system. When you encounter an infection or an injury, it triggers inflammation, your frontline defense protocol. But what happens when the system encounters a glitch? It gets stuck in attack mode. This chronic inflammation is the legacy system error behind arthritis, heart disease, and diabetes. Until now, treating this meant suppressing your entire immune system, leaving you vulnerable. Researchers at University College London recently published a study in Nature Communications that changes how we view this biological glitch. They wanted to study how the body naturally resolves inflammation in humans, so they ran a fascinating test. They injected healthy volunteers with UV-killed E. coli bacteria to create a temporary, controlled inflammatory response. Here is where the debugging process gets incredibly interesting. The scientists focused on small, fat-derived molecules called epoxy-oxylipins. In animal studies, these molecules were known to reduce pain, but their role in humans was a mystery. The researchers tested a drug called GSK-2256294, which blocks an enzyme that normally destroys these helpful fat molecules. When the volunteers took this drug, their epoxy-oxylipin levels surged, and their pain resolved much faster. But more importantly, the drug drastically lowered the buildup of intermediate monocytes, the specific immune cells responsible for driving long-lasting, damaging inflammation. It turns out, this fat molecule works by shutting down a protein signal called P38-MAPK, effectively compiling a biological patch that stops the rogue cells from multiplying. So, what does this data-driven discovery mean for your biological optimization? First, the future of autoimmune treatment is shifting from suppression to resolution. The goal isn't to wipe out your immune defenses, but to help your body shift smoothly from fighting to repairing. Second, the mechanism matters. This was a human-based trial using a drug that targets an enzyme, allowing natural protective fats to do their job. This opens the door for repurposed, safer therapies for conditions like rheumatoid arthritis. However, we must look at the data objectively. While the drug reduced pain and harmful immune cells, it did not significantly change outward physical signs like redness and swelling. And right now, this specific protocol is still in the trial phase. You cannot simply eat more fat to trigger this exact enzymatic blockade. To sum it up, chronic inflammation is an operating system error where the body forgets how to turn off its defenses. Science has now mapped the exact human pathway, using fat-derived epoxy-oxylipins to hit the biological brakes, stopping joint-attacking cells without compromising overall immunity. It is a massive step forward in bioengineering a solution for chronic pain.